first. Arthritis is defined as an acute or chronic joint inflammation in the joint. That is, here they are not specifically told as rheumatoid or osteo. This includes arthritis. So here it can be two. Osteoarthritis is like where there is a reduction in joint space due to osteophytes formation. In rheumatoid arthritis, there is an inflammation of synovial fluid or capsule, which will lead to joint stiffness. So the main common symptoms which are faced in both of these arthritis are joint pain, stiffness, decreased range of motion, and joint deformities. The patient will complain of severe joint pain in the knees or in any other part of the body, like any other joints. Stiffness will be there, like morning stiffness will be most usually seen, decreased range of motion, and there can be joint deformities, like valgus deformities or swan neck deformity, rectum deformity. Everything can be seen in these deformities. So, what are the newer techniques which we are seeing in this upgraded physiotherapy, like BFR? This is a first newer technique that is called blood flow restriction therapy. This is not usually heard by many. It is usually seen in gym or people who are under training. Like they will be tying a band of elastic band and doing the exercises. We will not be seeing that, but I will explain you in detail in the upcoming slides. Next we have LLT, that is low level laser therapy. Next we have ESWT, that is extracorporeal shockwave therapy. This is also comes under the matrix therapy, which our Sai group of health MD has did his course. And then optical illusion therapy, then hydrotherapy, and biopsychosocial approach. Actually, this last one is not comes under treatment, but it has its own value in the treatment sector. So next one is next slide. So background. Before we go, we should know what and all the previous techniques were there and how we are focusing on this. So recent advances in physiotherapy for arthritis have revolutionized its treatment. Traditional approaches focused on symptom management. Before and all, traditional approaches were focusing on the symptom management, but not the root cause of the disease. But now, what and all recent advances are coming are not only treating the symptom, but also finding the root cause and treating it, and even making the personalized treatment protocol. So advanced techniques like VFR, LLT, ESWT, optical illusion therapy, hydrotherapy, biopsychosocial approach, as I all mentioned before, are all addressing the root causes of arthritis. Okay? These advances are improving patients' quality of life. So this is the main. What we do is, if anyone comes with an arthritis problem, we just treat it as a symptom based. We don't ask them what work are you doing, what is your requirement, what your body does to do, want to do. This is called tailored approach or tailored treatment. We have to know the patient's interest, what he wants, and based on that we have to treat. So this all will be concentrating on the patient's improving patient's quality of life and reducing the burden of arthritis. So a patient with arthritis only can understand the burden. So that burden can be reduced by these treatments and making a promising shift in its management. So this management will be shifting the whole treatment which we are following before, will be treating to newer one. Next slide. So first one is blood flow restriction therapy. The images is clearly showing that image is clearly stating that the TheraBand or TheraBand, it is like a pressure cuff which is placed in the proximal part of the muscle, and they are keeping some pressure gradient and doing some mild resisted activities. How this does is, basically this resistance which you are placing or tourniquet like plating, this is actually blocking the arterial blood flow to the this is actually blocking the venous return from the part of the body to the circulation, central circulation. So what is happening inside the muscle? Now the placement of the TheraBand or the placement of that pressure cuff is in the distal part of upper arm. So it is blocking the blood flow from forearm to reach the central circulation. So blood pooling is happening in the forearm. So when this pooling is happening, this is similar to the effect which we get during high weight lifting activities. So due to this, there is an increase in the muscle mass, that is called hypertrophy, can happen by doing a milder exercise. So how can this be applicable in this arthritis management? So arthritis will have severe joint pain, right? So there we need to concentrate on the muscle strength. So when we increase the muscle strength, the weight bearing on the joint will be reduced. So this can help in managing the joint pain by increasing the strength of the muscles around the joint. Thereby, pain perceived will be less. It is a strategy in the rehabilitation of osteoarthritis due to gains in strength and volume with low mechanical stress. Here, the person is doing only 20 to 30% of one repetition maximum. Okay, and however, the application must be safe and individualized. This should be done by based on the muscle strength how they are having, not for everyone same pressure, and it should be monitored by the certified therapist. Next slide. Next slide, no? Yeah. Next one we have low level laser therapy. So laser therapy there are two types, high level and low level. But here we are concentrating on the low level. So here we are using 632 nanometer to 1064 nanometer of frequency or wavelength to treat the tissues. How this is doing? The image you can see that it is reducing the immune cell infiltration. So I have told you in rheumatoid arthritis there is an inflammation around the joint swelling. So that and all is getting reduced. And cytokine production. Cytokines are the inflammatory mediators. Even that will be reduced, and even pain will be reduced, and edema. This is a characterized feature of the rheumatoid arthritis where there is swelling around the joint. So that edema will also be reduced by low level laser therapy. And what it is making, it is increasing the joint flexibility. When the effusion is reduced, the joint flexibility also will be increased, and tissue regeneration will be increased. Chondrocyte proliferation. Chondrocytes are the cells which will help in formation of the muscles, or chondrocytes like making the bones, osteophytes, that and all it will helping. Next slide. Next we have extracorporeal shockwave therapy. This one has benefit effect on cartilage, subchondral bone, and surrounding tissues. So what and all I have put the references, what and all I have put the information here are coming under the research. Did literature review. Based on that, I have mentioned the citations also. So what they are telling is by using extracorporeal shockwave therapy, we can make micro damages in the tissues, which will help in regenerating the tissues. You can see in the image that chondrocyte activity is increasing, cartilage repair is increasing, and osteophytes are decreasing. So if osteophytes is decreased, there is no unwanted bone formation, which will happen in osteoarthritis. And even the inflammatory activities also will be reduced. There you can see osteocytes will increase the subchondral bone regeneration. There you can see the bone has cavities inside it. So that can be increased by giving this extracorporeal shockwave therapy. What's happening in the ESWT is they're giving the shock waves to the bone to have the distracting mind, like it is cognitive system is getting engaged in this. So what is happening here? Arthritis pain is reduced by mirror reflection or healthier joints. Like if the person is having severe pain, he will be always worried about the pain. Even if we tell him to distract, he will not be distracting. So what we do here in this optical illusion therapy, we give the image to him such that the joint is stretched and shrinking. By doing this action, this can be having the psychological effect as the pain is getting reduced. Next slide. Next slide. Next is hydrotherapy. As we know, hydrotherapy in this we are seeing the buoyancy effect, Archimedes principle, and we have resistance can be get from the joint which is milder, and we feel relaxation when we use warm waters. As the pain is there, we use more warm water like whirlpool bath and all, which this and all also useful in the management of rheumatoid arthritis. Next one. This is biopsychosocial approach where we see biological, psychological, and a social approach where biologically we see what and all disability they have, psychologically we see the behavior, we have to manage it, and socially we give the support for the individuals like vocational rehabilitation or occupational rehabilitation. Next one, result. So here we come to conclusion that methodology I have used this Cochrane, Central Library, PubMed, and EBSCO and Google Scholar to get the information. Next slide. Results are dead flow will achieve, as I told before, will give them joint strength, reduce the effusion, make the psychological support, give the psychological support, and reduce the pain. This is the main approach of this. Next one. This is the same I have mentioned in detail. And discussion at last, we came to know that we have to upgrade to the newer technologies, and even keep the traditional treatment. With that, we have to include this newer technologies. Yes, next. So So at last, I would like to conclude the topic that we have to use the newer techniques for the management of offshore. That is not important. These are my references, and this is my future work which we have to concentrate, like personalization, mechanism of action. We have to know. This and all are still under research, so we have to make still more researches to conclude the treatments. So thank you all.
Judges, you can ask your question. Aishwarya ma'am, you can ask your questions, ma'am.
Okay. Welcome you, Shankar. Your presentation was good actually. I have few questions on your presentation. So you were telling about blood flow restriction therapy, right?
Yes, ma'am.
Can you tell me what are the contraindications for blood flow restriction therapy?
Blood flow like stroke, who had a previous stroke, we should not give them. Anyway, blood circulatory disorders who have, for them we should not give. Who are hypertensive and who have arrhythmia, who are under anticoagulants, antiplatelets, for them and all we should not prescribe this treatment because the blood flow will be very get some circulatory disorders.
Okay, and this blood flow restriction therapy can be given at which stage of arthritis?
It can be given when the joint is having severe pain, when the joint cannot load the weight which we are giving to strengthen the muscle. So this BFR is usually given for them only who can't do the weightlifting, for them who want like geriatric patients, osteoporotic patients who are not allowed to lift more weights, they can go for this treatment. So in which stage of like in third stage or severe stage of osteoarthritis or rheumatoid arthritis, where the joint will be severely affected, there if you want to strengthen the muscles, then we can give this BFR.
For geriatric patients, with regards to aging, they have differences in their blood pressure, right? So, will this therapy be suited for them?
Yes, ma'am. We can give. There are some criteria to be followed while giving blood pressure. So it is basically for them only to maintain the muscle bulk properly. Because as the age goes, even they'll be diabetic. For them also it will be useful for maintaining.
So you maintain muscle bulk in geriatric patients.
Yes, ma'am. Muscle bulk means not like hypertrophy, ma'am. Instead of going to flaccidity or this thing, as the muscle bulk is fat, as a diabetic, that can be prevented by.
So, what flaccidity has to do with osteoarthritis?
If there is no muscle strength, then the weight loss.
Not flaccidity. You call the term flaccidity?
Reduced strength of or hypotonia, we can.
Hypotonia. What is
reduced muscle
hypotonia? Muscle tone is very less.
Yes.
Then you were telling about some criteria with regards to geriatric patients, right? So can you elaborate on that?
Actually, I'm not sure about that criteria. It's just prepared in brief. But as per I saw, there was some blood pressure which has to be kept. Like 80% of occlusion of arterial should be there. Veins should be
there. By default, due to aging, their blood pressure, everything will be less. So, and their even cardiovascular parameters will also be very less with regards to aging. So, does it fit for them?
As per I have.
Because you said, I'm asking, like, I really wanted to know, that's why. It's not like I want to question you more and more on your topic. You said that concept, so I'm trying to learn and that's why I'm asking.
As per I saw, ma'am, there was articles which was giving that BFR is usually used for geriatric patients. And who are not.
Did they mention about any protocol in that?
I didn't went that deep, ma'am, but that's how it is.
Okay. Okay. Then, I mean, that's this BFR can be given for all kinds of arthritis.
Initial stages is not recommended, ma'am, because we can do the normal rested exercises. Then we don't need to do. If they are more severely affected, if there is joint loading is not allowed, it is more painful, then we can go for this.
No, I'm asking whether you have various types of arthritis, no?
Yes,
So
ma'am.
does it work for all the arthritis? Or you have any precautions or criteria like this must not be given for this arthritis or anything like that?
We can give to every arthritis because only joints will be involved, so no muscle will be involved much. So when joint is involved, obviously loading is restricted, so we can go for BFR for all type of arthritis.
So you have something known as hemophilic arthritis. Does this BFR fit into that?
Hemophilic arthritis was not aware. Should know about that.
So it is something related to a blood disorder. So
Yes,
okay, fine. So what something you said about optical illusion?
Optical
Can
illusion
you
therapy.
elaborate on
In that therapy, they usually, as arthritis,
what is optical illusion?
they'll give visual stimulus. How in arthritis they'll be joint and they'll be seeing that deformed joint all the time, and they'll be having that concern in mind. My joint is not good and I'm not getting well, and it is more painful because it is swollen. So what they do is they show the deformed joints in a normal way. So what they get is that their joint has become normal and the pain has been subsided. This is actually cognitive engaging type of therapy, and it will distract the people from what they are perceiving. It is like playing with the psychology.
So you said they will show deformed joints in yeah, you said deformed joints will be shown in a normal way. How come like they show so many photographs or anything?
No,
how they actually do it?
They will use some application based app or any visual giving stimulus phones or cameras. They will show the joints in, like we have a convex and concave mirror, like that. They will get the image in that such a way to manipulate in the image and show it for us. It will be shown live, not others joint, but their joint, but it will be shown live.
Okay. Thank you. I'm done with my questions. Aratapal sir, you can go ahead.
Thank you. Hi, brother. Hi, brother, am I audible? Sorry, your voice is very far away. Am I audible now? Yeah. Now I can. Yeah. I have similar kind of questions what Aishwarya ma'am asked. See, we have some issues with DFRT on working with rheumatoid arthritis. And you mentioned, in your presentation, you have mentioned only two arthritis, like osteo and rheumatoid. So I think like working with rheumatoid still is a bit of controversial, and also as you explained with geriatric population also, there is some contradictory. I mean, it's a proven technique. DFRT seems to be an effective technique, but still it has some controversial things happening around working with geriatric population and some metabolic conditions. So that's okay. And even I had a doubt on optical illusion. I'm okay with that also. See, you have done a presentation on literature review, right? You have collected certain list of articles and you have presented, right? Yes. Yes, sir. When you collect set of articles and a pattern of presenting with the literature review, what you can do is still you can be more precise on methodology part. You have missed the methodology part alone in your presentation. That is what I'm saying. You have collected some good reason interventions which you use it for architects, but you have missed the methodology part on how you collected it. The filtering data and what criteria I took. Yes, sir. Yes, sir, I can hear you. Is it audible for you? Yeah, sir, I can audible. Yeah, you are audible, sir. Yes. That part alone you have to work, and also do spell check before you present it. The first slide and all, you have some spell correction and all, spell check before you present it, okay? Okay, sure, sir. Other than that, it is very good effort, and congratulations. Thank you. Thank you. It was my first presentation, sir. Very good step. Keep doing it. Yes.
Good only, Gagan. We are not finding faults in your presentation.
No.
It's actually making you to improvise. Anyways, it's a good one only. You have worked on into so many concepts which are not known by many people. Okay, so you just take these points as suggestions and you can improvise in your future presentations.
Sure.
Okay.
Sure. Thank you. All the best, Kevin. All the best. Thank you, sir. Thank you.
Thank you, sir and ma'am, and thank you for your wonderful presentation, Gaganu Shankar, and best wishes for you.
Thank you.
Thank you. The next presenter is Kaniyan Pungundran. Are you ready, Kaniyan Pungundran? Okay. And next presenter is Vismaya Biju. Vismaya Biju? Vismaya Biju is there? Okay, we can go for another presenter. Sir. And another presenter is, the next one is Jeeva Ratnam. Jeeva Ratnam?
Yes, ma'am.
Yes. Okay.
Yes, ma'am. I'm ready. I'm audible.
Okay, I will share your presentation. Is this visible now?
Can I start?
It is visible now?
Yes, ma'am.
Yes. Okay, you can start.
Good evening. I'm Jeevaratinam from Savita College of Physiotherapy, presenting DBD fifth semester. I'm very happy to present the paper on this beautiful occasion of World Physiotherapy on the topic Advancement in Therapeutic Exercises and Manual Therapy in the Management of Patients with Rheumatoid Arthritis, literature review. Now next step. And next step. First of all, introduction. Rheumatoid arthritis is a progressive autoimmune disease that relentlessly targets the joints, demanding long-term management for improved quality of life. To put it in perspective, the annual incidence of rheumatoid arthritis was between 40 to 71 cases per 1 lakh people. By the study conducted by Sigmund and others in the year of 2018. But in recent time, the way we approach its management has evolved. We are witnessing a shift towards non-drug methods, particularly therapeutic exercises and manual therapy gaining prominence in the management of rheumatoid arthritis. This advancement now incorporate with sophisticated pain management techniques to help individuals cope with challenges of rheumatoid arthritis. Now next, can you please change this? Our aim is to review the available evidence on the recent advancement in therapeutic exercises and manual therapy for the management of patients with rheumatoid arthritis. Our objective is to explore any emerging trends or innovation in therapeutic exercise for rheumatoid arthritis management and to evaluating the impact of technology and telerehabilitation in remotely monitoring and management in rheumatoid arthritis patients. Next. Then selection of our studies. We have read totally 143 titles we have minded. Of these 143 titles, we have excluded 67 by reading only abstract and titles. 76 full papers read we have taken. Among the 76 full paper read, we have included only 11 and 65 are excluded, which doesn't meet our inclusion criteria. Then by the bibliographic search, one study where we found, by the expert recommendation, we found three reviews, three reviewed articles. Then totally 15 articles were included in this review. Ma'am, next. Then literature search strategy. In a Boolean operators will be used to combine words like rheumatoid arthritis, therapeutic exercises, aerobic exercises, daily rehabilitation, and manual therapy. And these are the keywords for searching this literature. We were only searching for articles in English. Ma'am, next one. Then in our inclusion criteria, we consider peer-reviewed original research, including RCT systematic reviews, specifically focusing on rheumatoid arthritis study. Priority was given to research on therapeutic exercises and manual therapy on RA management, with outcomes included pain, strength, function, fatigue, joint mobility, and quality of life. We included studies published within past 15 years for the current relevance. Next. Exclusion criteria. We have excluded editorials, non-primary researchers, conference abstracts, then studies primarily focused on drugs, those lacking the relevant outcome measures, and non-English studies were completely excluded. Next. Now let's delve into distribution of intervention we found in the reviewed literature. If you look at this pie chart, it consists of 8 different types of intervention with the different approaches, and the intervention involved in the reviewed literature are mentioned in percentages, and the mentioned intervention are here reviewed for literature. These are the intervention and approaches involved in the included study, and we look into detailed description of this study from hand exercise to daily rehabilitation. Next. Here let me look at this table of included literature, and I want to mention the order of the study are not based on the year, and it is based on the intervention the study provided. First, I'd like to highlight two pivotal studies from 2012, both examining the ZARA approach for managing rheumatoid arthritis in the hand and wrist. ZARA is abbreviated as stretching and strengthening for rheumatoid arthritis of hand. In these two studies, each group involving 240 participants, total of 480 participants. The ZARA approach was compared to conventional therapy. The ZARA approach included a specialized hand exercise program. The studies assessed the various outcomes like grip strength, dexterity, and quality of life score with follow-up at 12 months. Any and others focused on development and delivery of ZARA approach. And it is the large multi-centered study for a randomized control trial, and they were not concluded the effectiveness. And its effectiveness were concluded in another study, and that is ZARA trial team study, which is in the second reference ZARA trial team on the study, and they were sought to determine the clinical and cost effectiveness of ZARA approach, shedding light on its potential benefit for RA patients. Next. And next, these two intervention mainly focus on aerobic exercise and some therapeutic exercise program. In 2013, SE and others with 30 Chinese female patients with rheumatoid arthritis aged 32 to 64 underwent the 8-week trial. They were divided into Group A and Group B. Group A had supervised aerobic exercise. Group B had home-based exercise. The results showed the supervised exercise significantly improved aerobic capacity. In 2017, Shinde and others, 30 adults aged 35 to 62 with yearly RA were divided into two groups. Group A for therapeutic exercise like range of motion and aerobic exercise. Group B had conventional therapy. What conventional therapy as they mentioned. After 12 weeks, therapeutic exercise program provided effective in improving functional status, grip strength, and perceived health in these patient mappings. Next, these two studies focus on home-based exercises. Rodriguez study 36 rheumatoid arthritis for 3 months using calendar versus control group with written exercises. The app improved hand function and its satisfaction of the patient. Ma'am, next. And next is three studies involved of reflexology therapy. Reflexology is applying of different pressure in foot, ear, and other parts of the body. In 2015 case study by Khan and others received 6 weeks of reflexology treatment, while it showed potential for managing foot pain. And as by the preliminary study, reflexology therapy and foot massage were given, where the reflexology was considered as a good treatment. Next. The study by Medine was by the aromatherapy massage. This one, the aromatherapy massage was good compared to the reflexology therapy. Next. Next, this study focus on stretching isotonic and isometric for group group A, group B, group C. Group A had isotonic, group B had isometric. Then the study reveals isometric and isotonic hand exercise improve hand functions, dexterity, and the quality of life. Next.
Go on.
Next is the randomized control trial conducted by STK7. This study developed by Mysara online version of Zara program for rheumatoid arthritis tested it with 9 participants over 2 cycles. Most found it useful and user friendly. And the study conducted by doctor conducted an RCT with 30 RA patient used telerehabilitation with adaptive care. Noted for the this study is noted for the precise outcome and relevant for discussion. Next to systematic reviews. First of all, systematic review by Bergster and others reviewed 8 studies from the year of 2000 to 2014 on hand exercise therapy for RA, showed improved friction without worsening of pain or disease activity. Longer intensive therapy yield better results. Specific exercise types require more research. Study 2, that second systematic review is by Han and others evaluated Tai Chi Chuan for rheumatoid arthritis used the large quality life for a clinical impact. 15% improvement was identified among the patients. Next. Validity criteria and data extraction criteria were assessed in this study, and these criteria were validated by Van and others. And these criteria are for randomization, allocation, baseline similarity, care-provider blinding, co-intervention, adherence, patient blinding, withdrawal rate, outcome assessor blinding. These are the timing of outcome assessment. These are the validity for the validity criteria. Next. Then the data extraction criteria is by eligibility criteria, description of intervention, outcome measure, follow-up, adverse reaction, study size, intention to treat analysis, presentation of data. Through this, we have included the data extraction criteria, and these are the validity and data extraction criteria. We have put negative indicates that is so much irrelevant information. Unclear means that this ambiguity in meeting the criteria. Positive means validity score indicates that the study meets the criteria. Next.
Sir, please wait. I will ask to the judges if you are continuing or not. Because your time is up. Ma'am? Aishwarya, ma'am?
Yeah, how many slides left for him?
I'm not 8 slides, ma'am.
Oh my god, it's really big.
Ma'am, can I only conclude the discussion part and come?
Yeah, just go ahead.
The discussion is the ANE and Zara trial. They were not mentioned the age of the participant. It shows the internal validity and external applicability of the study. Next, the aerobic exercise. As highlighted, the study offers only a small sample size. Next, the reflexology therapy and the foot massage massage. Study conducted by Khan and Water and also by Metin provides small sample size, limited generalizability, enter our ability to draw a solid conclusion. Next. Next, stretching exercise by Sadegi and others suggests effectiveness of stretching exercise reducing RA patient severity. Moreover, the study findings of shoulder reflexology massage does not significantly affect RA patient RA pain. Challenges that predictability of multiple therapies in RA pain. Next, Dogu and others, isotopic and isometric anti-exercises for RA patients. The study have lack of follow and intervention duration and a small sample size. These are the notable limitations of this study. Next, study by Sri Kesavan on the Mysara software. This study have small sample size and primarily focus on usability. They were not concluded any benefit for the study. Next, the teleapplication introduced by D. Lockery et al. In the year of 2011 tracks and movement in RA patients. This study is notable for the precise outcome measure. Lastly, systematic review. The systematic review by Bergstra and other systematic reviews suggest hand exercise may benefit. These have a limited number of studies. And the study by and others, systematic review indicates Tai Chi might enhance lower extremity range of motion. This study have methodological limitation, underscoring the necessity for more research to elicit Tai Chi in the method arthritis management. Next, ma'am. Next. Then we came up to the conclusion. While the literature suggests promising therapeutic exercise, manual therapy, and modern approaches like telerehabilitation and software for managing rheumatoid arthritis, it's important to note that many of these studies do not adequately address long-term effects. Therapeutic exercise offers holistic pain relief and improve joint function, while massage provide alternative pain management. Telerehabilitation and apps like Mysara and Karen hold potential for personalized remote care in rheumatoid arthritis. These were we conclude. Thank you.
Algappan sir, we can ask a question, sir.
Yes, it is a good elaborated literature presentation. Am I audible?
Yes,
Yes, sir, you are audible. Is this the paper you create Savita right now, or else it is an existing paper that you collected and you are presenting? No, sir. These were reviewed by me and my guide. These are original results. So it is not an existing paper, right? Yes, sir. This is not an existing paper. Okay. I have even it is a very proud moment for us to mention this service used from our own Tamil Nadu. And the most important thing is that Mysara software is the constant So my thing there is, if you recommend anything, a holistic, better protocol-based approach for rheumatoid arthritis, did you find anything on this study? Sir, by this literature review, I found personally my recommendation for the patient is to recommend like telerehabilitation or software-based interventions, sir. Because the software-based interventions provide good biofeedback to the patient and gives motivation to the patient. That's why I said I agree. That's why I said Mysara is a wonderful software. I'm asking, do you find any protocol which is more like Otago protocol for similar to that, did you find any good protocol for RA? I think Mysara consists of three holistic approaches. Three holistic process, in the 3 steps. That were the good approach I have found. I think that part we need to explore, but it is good. Okay. The other thing is, did you mention any manual therapy specific techniques? But you mentioned manual therapy. Is there any manual techniques that you can discuss? Massage, therapeutic massage and reflexology were we forms. Okay, Jiva. That is good presentation. Good elaborated one and the literature review. So it should be okay. So okay. Aishwarya.
Yes, sir. Yes, sir. Jeevaratnam, yeah, a very good presentation. I mean, you have done a lot of literature search as well. So, appreciations to you and your guide for supporting you like this. So, my question is again, sir has already asked. You have mentioned about manual therapy in your title. So, I was about to ask, did you come across anything related to manual therapy? Actually, he asked a question. And while you were mentioning, no, you said something about grip strength. So, what kind of articles you came across with related to grip strength? Like,
Ma'am, for grip strength, I found 4 to 5 articles. I think so fairly, and that yes, ma'am, and that articles are. Can I check it, please?
yes, please.
Ma'am, from Zara approach, I found grip strength, and as well as from Zara trial team. Next, from the study by Z and others on aerobic exercise, I found grip strength. Next, therapeutic exercise program by Shinde and others, ma'am.
What aerobic regarding aerobic exercise? What was it mentioned? Aerobic exercise and grip strength.
Regarding aerobic exercise, they mentioned
Conclusion drawn from the study.
from the conclusion drawn by study Z and others, Chinese female patient with rheumatoid arthritis showed significant improvement in aerobic capacity through 8 weeks supervised aerobic exercise superior to WOM programs. These were the conclusion by the author, ma'am.
Okay,
But they also mentioned outcome measure as grip strength, ma'am. So I put that.
outcome measure as grip strength. So, what did they give to improve the grip strength?
They were nothing mentioned, ma'am.
Then how
Also-
come your grip strength?
Also, they have included stretching and strengthening as a part of their intervention.
Okay. Then again, you said something about fatigue. So, with regards to fatigue, what kind of articles you come across?
With regard to fatigue,
I mean, did you come across any kind of protocol related to aerobic exercises?
no, ma'am.
Like, why are we actually giving aerobic exercises for rheumatoid arthritis patients?
Ma'am, for rheumatoid arthritis patient, they were very fatigued. To induce relaxation, we give aerobic exercises and to improve the functional status of the patient for the better circulation, blood circulation. That's all.
Okay, and you were telling something about reflexology. What is that? Can you elaborate on that?
Ma'am, reflexology is applying different pressure to the body parts like foot and ears. These reflexology have an indirect effect on the autonomic nervous system. For example, the heartbeat can be the heartbeat of the patient is controlled by the reflexology and the respiratory rate also.
So, what does it have an impact on rheumatoid arthritis? What you're actually doing with the help of autonomic nervous system?
Ma'am, we relaxing the patient like excessive heartbeat, increased respiratory rate. We control.
Why there is those things are going for an increase? The problem is in the joints only, no? So why Does it? Why is it increasing?
Because of excessive fatigue, ma'am. They have joint pain. Because of pain, there will be increased function of the system.
So mostly they will be on medications, right? So will it not control the pain?
Ma'am, these articles mostly I have took 15 articles, ma'am. Among these 15 articles, eight or nine, I think. 9 articles where the patient didn't take any medication and followed only exercise protocol. So I only had idea regarding this.
Okay, Jiva. Okay. Good presentation. Okay. Thank you.
Thank you, ma'am, and sorry for taking too much time.
Not an issue. Not an issue.
Actually, ma'am, the only thing
Yes.
is there was multiple intervention in this study, ma'am. That's what
Yes, yes, sir. Yes,
other
sir.
than that, it is good.
It is good only. Yes. He has written a lot of inputs. It is good. It is a very big paper actually. So you can somehow you can precisely do it. Not a bit. Next time you can do it accordingly. Yes,
Thank you.
good only.
When you are going for such a big topic, go more specific. This looks like a generalized treatment.
You can work on any specific concept you can work. Like only therapeutic exercise means a specific kind of exercise you can work on. You can take any resisted exercise alone or any kind of aerobic exercise alone. Anything you can just reduce your circle and you can work even more. Okay, so next time if you're doing, you try on that aspect. Okay.
Okay, sure. Thank you.
Thank you.
Thank you, ma'am and sir, and thank you, Jeevaratnam, for your presentation. The next I call upon Kaniyan Pungundran. Kaniyan Pungundran?
Yes, ma'am. Am I audible, ma'am?
Yes, yes, yes. Please wait, I will share your paper.
Okay.
Is it visible? Is it visible? Yes, yes. Yes, you can start.
Yes. Good evening to all. This is my presentation. The effect of the data of the
Your voice is not clear.
Am I audible now?
Yes, now it is okay.
Okay. Okay, ma'am. Can I start now?
Yes, yes, start.
Okay. Okay. Good evening to all. I'm a researcher. I'm a study coverage and the evidence of data application and the types of issues species and doing pain results in osteopathic patients. Guided by developing research, and research oriented exercise and control therapy. Next day. The disability of the has really it's good. Is the function that is in the pain for the patient and my gradually basically the rate of functions and the pain is the patient. So because I will start the manual therapy for the patients because external. Our aim of the study is to investigate the negotiation and exist for the related pain, decrease the pain for the patient. And the area of the city, many of them used to the convention and along the road to treatment. Excessive and we try to use the another therapy technique that make the association and for improving the doing the school with the patient. Next slide. And the study between us randomized and the study between us randomized to and the study between us outpatient department and the and study population as a patient with the moderate activities taking the radiographic evidence. And the duration of the studies 6 weeks from pre-treatment studies and alternative days with holidays. And the fixed period is still affect the aspect of the patient and the last assessment aspect of the fixed of the patient. And we are assessing the outcome of the visual analytical and the period to and the test of the and the moment to say and to step up to the patient. Next slide.
1 minute. Judges, is the Canadian movement voice is clear, ma'am and sir?
Yes.
Okay, sir. Okay. Yes, you can continue.
Yes. And the self-expectation of the patient and the improvement is unilateral after the patients and the pain during the weekend activities of the therapy. And we selected the patient at least 90 to 90 just the rate of and we explore the patients of and the person we with the patient to a degenerative of the patient or any patient taking and the patient receiving and the recommendation is made upon our outpatient department and the recommendation is made grade 3 and grade 4 for the patients for the pain. Therefore, as performed in the initial state of the patient pain level of the tolerance of the pain related to the grade 4 and maximum the grade 3 of association pain. And patient level is present under the index of the patient where using the 1 hour accident given 30 seconds between the rest after the operation. And the championship program will be in the control and next one. And that is the data of the first we compare the for the AAS and the consulting and the fact the data of the patient. And the comparison of the AAS and the and the P-value of the 0.5. Next and next the research shows the experimental group was the experimental group having a mobilization and only conservation along with the conservation. The research process stands experimental and but the experimental highly and the discussion. The alternatives problem in the conflict. Human have more different chances to compare and we are not relating conflict related to degenerative behavior. The goal of the degenerative is to control the pain and minimize the side effects of the hormone and restore the department. The alternative is to get the control of pain loads of the loads between the times of the exercise and during the exercises and control physical activities of the witness and the patients having disease of the supra and the patients having the supraspinal mechanism to receiving the patient's pain. Next slide. And that's it. The patient study for inside the mental representation and the patient to receive the conservation of the highly Thank you.
Thank you. Aishwarya ma'am, you can ask your questions, ma'am.
Okay. Kanyan Pongundan, your presentation was good. My question is, why are you giving trunk stabilization exercises for OAV patient? What relationship does it have?
Yes, yes, ma'am. After the discussion, we will but initially the patients suddenly they don't have a difference. So it's the patients have a difference because of the uneven behavior, unproven partial behavior. So the patients have the period times because of the period to the proximate part, what leads to the maybe so the proximate of the proximate part after the
Okay, you were with regards to sample collection, you said people with moderate OA were selected for your study. So, what do you mean by moderate osteoarthritis?
moderate osteoarthritis, degenerative changes can measure that.
Voice is not clear. Voice is not clear. Voice is not clear. Yes, yes. Yes, yes. Go ahead.
So moderate osteoarthritis between the developing the pathway developing the osteoarthritis.
Sorry, can you repeat again?
I'm adding.
Your voice is not clear. Getting a lot of other disturbances. Yeah, tell me. Yeah. Tell me what is moderate osteoarthritis?
I'm adding.
Yes. Yeah, please.
Okay. If you take the patients regarding X-ray based on the radiographic evidence, ma'am.
Okay. So radiographic evidence, how will you conclude the person is having moderate OA? Do you have any kind of criteria for that?
Yes, ma'am. We have a criteria about the radiographic evidence. The
With regards to VAS, at what level of VAS you choose people? Not age group. I'm asking about VAS scale. Did you work on that pain status as well? So what? It is a 0 to 10 scale, no? So at what level you took patients? 6, 7, 8.
Yes, ma'am. 6, 7.
So I think the pain will be really tremendous. So did they cooperate with you during the treatment?
Initially, the patient paid, we accepted the pain and we gave the oscillation. So, depending upon the patient tolerance of the pain, we give the
Okay. So what kind of front stabilization exercise you gave? You mentioned that in your presentation, I think. Yes. Yes, you're audible. Like what kind of front stabilization exercises you gave?
So we concentrate on those core data muscles.
Okay, so did you follow any protocol related to that?
Patients laid on in the board patient and then it asked the patient accept the patient after saying happy and after accepted they tell the patient to lift up the board and then ask.
So you give manual therapy as well as tongue stabilization exercise on the same day.
No, ma'am. We do the rest of the business. We do the rest of the read certain for the medication can be done.
Okay. Okay, thank you. Agapan sir, you can go ahead.
Daniel, what's your sample size?
We selected the bit 40 pages. Sir, I'm adding.
How much it is? Yeah, you're audible. How much it is?
Yes, we selected around 20 pages.
20 patients. So 10 and 10 in each group.
Yes, sir.
After research, and you just move to the methodology slide alone.
Okay, sir.
Yes, ma'am. Okay. So 20 patients, so 10 and 10 in each group. Correct, right?
Yes.
Alright, Tanin. I don't have any specific questions. Already, Aishwarya ma'am has asked anything. See, I recommend you to go and have a look on stages of OAD. Okay, once we done the session, just go and have a look on stages of OAD. And apart from that, it is a normal presentation. Is this your UG paper?
No, sir. It is very.
Is this your UG project?
No, sir.
Okay. So where did you got this paper? Like, how do you make this paper?
Sir, the researching about articles are regarding articles, osteoarthritis, and research the articles and they found the mathematics.
Okay, Daniel. Okay. All the best. Thank you.
Thanks.
Thank you, Ragappan sir, and thank you, Aishwarya Madhuni ma'am. And thank you, Kaniyan Pungundran and best Mr. Polu. Thank you. The next presenter is Vishmaya Biju. Vishmaya Biju, are you ready?
Yes, ma'am.
Yes. Okay, wait, I will share your presentation.
Stop sharing. Stop sharing.
Is it visible?
Yes, ma'am.
Okay, you can start.
Okay. Good evening, all. Myself, Vishmaya. Today, I am going to do paper presentation on latest trends on physiotherapy in arthritis management. And the title of my paper is Era of Technology in Physiotherapy of Arthritis Management. And here we go with the introduction. Arthritis is defined as an acute or chronic joint inflammation in the joint. Arthritis may attribute to a wide variety of symptoms that include pain, stiffness, decreased range of motion, and joint deformities. Through advancements in technology, arthritis management is leveraging the ability to push the envelope in hopes of an standardization of treatments to provide pain relief, to increase range of motion and reduce disabilities. And here is the normal PT management that we give for arthritis. These are like aerobic exercises, then we give muscle strengthening, then other modalities. Next slide. And this, sorry. Ma'am, can you please go back to the previous slide? Yeah. These are the advanced technologies that I am introducing here in this paper, like tele-rehabilitation, then virtual reality, robotics, rehabilitation, etc. Next slide, please, ma'am. Then here we are seeing the objectives of the study. Like this study is conducted to find out the recent evidence-based physiotherapy techniques in treating arthritic patients. Technologies like telephysiotherapy, virtual reality, and augmented reality, gamified physiotherapy, robotic-assisted therapy, biomechanical analysis show effective reducing the pain intensity, improve mobility, and assist their areas for arthritic patients. Then we are going with the literature review. Here I did a literature review of 6 articles for these 6 technologies that we are seeing here. The author Adelsola study showed that the tele-rehabilitation shows similar outcomes of pain and physical function as clinical-based rehabilitation that followed for 6 weeks. This study was about tele-rehabilitation, and he is telling that it's same like clinical rehabilitation. The result was came, and then Johanna study showed that no conclusive evidence that interventions based on virtual reality are increased effective than standard physiotherapy treatment in OA rehabilitation. And the other study was conducted by Floria. Their study concluded that augmented reality raised awareness of difference between OA and RA. They didn't go with the pain management or something like improving areas. They go with raising the awareness of the difference between OA and RA. Then the other was about robotic assistance rehabilitation. It is for after surgery, that is TKR or THR for OA. For this study suggested for robotic assistance rehabilitation. Next slide, please. Then for knee OA, gamified specific gamification through VR glasses added to conservative treatment has a positive effect on pain, functionality, and balance. And here in this study, they are telling like specific gamification, that is through VR glass, that is virtual reality glasses. It is helpful for reducing pain and improving functionality and even balance. And at last, we are going to see about the biomechanical analysis of rheumatoid arthritis of wrist. To analyze biomechanical difference between healthy and diseased joints. 3D models of these two wrist conditions developed from CT images. Really, biomechanical analysis is really helpful for managing OA. It is not an treatment, but it is helpful for investigation. Next slide, please. And methodology. 5 databases were searched for recent advances in physiotherapy for management of arthritis in Cochrane. PubMed, Google Scholar, Central Library, and EBSCO are and sources of genuine sources manual. Next slide, please. And the conclusion is in this review of study, all the 6 articles about 6 advanced technologies of physiotherapy that is for arthritic management show positive result for reducing pain, improve functionality and ADLs in arthritic patients. All these studies suggest for more studies that for several long-term effects structurally and functionally, and also need RCT to determine the effectiveness of them. And even by the study, I also got the conclusion that there are very less articles for this topics, like these kind of technologies. So we need more studies for this advanced physiotherapy technologies. And next slide. And these are the reference I used. Thanks.
Anagapan sir, you can ask me questions, sir.
Yes. Am I audible? Yeah.
Yes, sir.
Yes, sir. Yes, sir.
Yes. Shumaya, so you have sent me, yes, okay, you have sent us like 4 technologies, right? A, PR, biomechanics, and what are others?
Virtual reality, augmented reality.
That's like PR, A, augmented reality, AR again.
Yes. Then biomechanical analysis, then robotic assisted physiotherapy, then gamified physiotherapy, and that's our telephysiotherapy.
Good. Okay. So you are talking about the recent technologies or the upcoming advanced technologies which is available, right?
Yes.
So being arthritis a long-term managing condition, what we need to know here is some device which can monitor a patient. Let's say VR is useful for post-op, as you mentioned. Any kind of app like earlier we discussed Mysara, those kind of apps are really, really good for following up our patient on lockdown. So again, the only thing which you need to mention here is again this is a literature review, and you need to be more specific on presenting the literature review. Let's say methodology, you said you have collected from 5 databases. There was no exclusion or exclusion criteria of your methodology part. Okay, so it is very simple. It is smart, but it is not elaborated one. Okay, another one is you have to be more specific on choosing one technology in future. Other than that, I don't have any specific comments. You have talked enough about arthritis. And by the way, which kind of arthritis you are mentioning here in this presentation?
In this, I generally talked about arthritis as the topic is focused on arthritis, and mostly seen arthritis was osteoarthritis. So, osteoarthritis we can take here.
Alright. Apart from that, it is good, Vishnu. Okay. Aishwarya ma'am?
Yes, sir. Again, yeah, the way you presented Vismaya, like you need to do some modifications. So when you're doing a literature review, again, you have to follow some sequence. So you explained everything in the beginning, and at last you're mentioning about methodology. It is not like that. Methodology should come after your background. So you have to mention like it must be in detail, like how many articles, what are the sources you chose, and how many articles you came across, and each articles were in favor of which kind of technical support you're actually looking for. So for VR means like how many articles supporting VR or how many articles were in favor of VR, you have to mention in that way, and it has to be in more detailing aspect. Okay. So then again, I was about to ask what type of arthritis you were looking in for, and you answered sir's question. So one question I have is, you were telling about telephonic rehab or tele-rehabilitation, yes? Yes. So, will it be accessible to all kinds of people? Like, suppose if it is incorporated, like, what kind of tele-rehabilitation you will do? Tele-rehabilitation programs are like designed with the aim of improving quality of services as well as overcoming limitations in terms of resources, management and accessibility of services. It is like same like clinical, but those who are not capable of going to the clinic and taking the service, they can go with this tele-rehabilitation. But those who are not able to get these kind of video calls and all, for them it will be difficult. That time we can do that with within calls. Within calls. So if you're prescribing any exercise and any kind of anything that has to be followed means, so you will do it and by means of tele-rehabilitation. Is that you're telling? Yes, ma'am. Okay, so people who can't access technology or anything, so will it be useful for them? No, ma'am. It is people in the remote area, suppose yes, just think about our country alone. So just think in that way. So will it be accessible by everybody, or what kind of changes you will do to increase the accessibility? That can we can give more awareness to the people about this tele-physiotherapy. Even most of the people are not aware of physiotherapy only. So we have to go more some remote areas. No, the level of education will be very very less, and the exposure to technology. And some people still they doesn't know to use mobiles also. So like how you will connect with such kind of people. For such kind of people, okay, so did you come across any kind of smart wearable devices in your literature search? No, smart devices, anything like that? I remember I didn't. Okay, then with regards to VR and this AR, augmented rehabilitation, so did you come across any kind of age group for which this kind of techniques were incorporated or used? Mostly for geriatric. Geriatric. Okay, so age group like in between 50 to 70 to 77. 70. So age of 50 will not come under geriatric population. So age from 65 and above will be coming under geriatric population. Okay. So okay, Visma, you need to work on even more. But anyways, next time when you're doing, you can take any specific type of arthritis and you can work in detail. Okay, so if you come across any kind of good technological support, you can try to incorporate the same for the patients whom you come across also. Okay. Thank you, Vismaya.
Madam, at one VR devices is coming up with some sensors. So, Vimaya, you have to check out with some sensors. And as ma'am rightly pointed out, you need to look out for a better alternative in case of people who couldn't able to get access to the tele-rehabilitation. So, supporting people from your team, in future I'm saying, supporting people from your team can go and help your patients on their home. You can pick some other alternatives to reach tele-rehabilitation.
Okay.
And otherwise, it's a good presentation. Good.
Okay. Thank you.
Thank you, Aishwarya ma'am, and thank you, Aragappan sir. And thank you, Vishmaya Biju, for your presentation and best wishes for you. The next one, Rukshar Khanam. Rukshar, Rukshar Kanam. Rukshar, please turn on your mic. Rukshar Kanam, kindly turn on your mic. Rukshar Kanam को कॉल करना சீக்கிரம் நீங்க பிரசன்ட் பண்ணுவோம் பேச மாட்டோம் நம்மளே கால் பண்ணிக்கலாம் போயிடும் அவங்களோட ஃபீட்பேக் சொல்லலாமா இன்னும் 2-3 பேர் தான் இருக்காங்க மற்ற எல்லாரும் போயிட்டாங்க
Ma'am, we can have the next presenter.
Yes, ma'am. We all are done the presentation. So we go for
Okay.
your feedback, ma'am. So kindly share your feedback about the participant presentation.
Okay. Yeah, we have someone, Vidya Shekhar. Vidya Shekhar is a staff. Huh?
Yes, ma'am. She is a.
Oh, okay. Oh, sorry. Okay. So I was expecting 2 more people to present. Okay. So Rukshar Kanam is not there, right? So almost we are done with presentation, right?
Yeah, yes, ma'am.
Hello.
Rukshar Kanam?
Yes, ma'am. Can I audible?
Yes. Shall we start?
Yes, ma'am. Sorry for the inconvenience. I couldn't hear anything.
Okay. Ma'am, she is the last one.
Okay, ma'am. Yes.
Okay. Let us stop sharing the now. Is this visible?
Can I start, ma'am?
Yes, you can start.
Yes, sir, you can start. Okay. So, good evening to all of you, and wish you happy belated physiotherapy day. Today, I am going to take a paper presentation on latest trends of physiotherapy in arthritis management. And can I have the next slide? So my topic for today is evolution of physiotherapy techniques in arthritis management. And introduction. The common type of arthritis seen in general practice is osteoarthritis and is usually present in middle and late life. The clinical picture of this osteoarthritis involves the chronic pain in joints and stiffness, limitation of joint movement, crepitus, swelling. Most commonly affected joints are hip and knee joint. First, I would like to start with blood flow distribution therapy. It involves like applying pneumatic cuffs proximally on the lip to reduce the arterial flow to cause the venous occlusion this reduces the limb's overall oxygen with leaving limb in hypoxic state. Means the limb will be lacking the oxygen. In that state, it will leave, and then the deoxygenated blood will be accumulated upon the curve inflation and thereby providing therapeutic effect. Fast twitch muscle fibers recruitment will also occur in this, and there will be increasing growth hormone. And the use of this blood flow restriction therapy is also like it causes post-exercise hypotension when performing blood flow restriction therapy. The current evidence showed that 20 to 40% of 1 repetition maximum results in pain reduction in osteoarthritis. Next. Here we can see the normal joint and the joint with the osteoarthritis. We can clearly see here that the cartilage is lost, means it is degenerated, and it will leave the joint space narrowed, and there can also be formation of bone spurs. This and all contribute to pain and stiffness of the joint and limitation of movements. In the first picture, we can see the blood flow restriction therapy. The second picture is showing the Tai Chi exercises. Tai Chi means it is the slow exercises, which is like Chinese martial art technique, which will improve the flexibility, promotes balance, and reduces the pain and anxiety in the patient suffering from osteoarthritis. And the third one is the mirror therapy, which will cause optical illusion to patient and show like they are like moving their own hand. It causes like illusion in the mind and improves the movement and improves the patient's confidence. And the fourth picture indicates the virtual reality training, in which the person will be wearing this mask, and there will be like it will be computer operated, and they will see the images and videos in which they'll try to do the movements and improves their distracted mind from pain and improves the movement. Next slide. Next here we can see the shock wave therapy. It is like extracorporeal shock wave therapy. This is also a newer technique in the field of physiotherapy, which will help in reduction of pain, and it works efficiently in arthritis treatment. Next slide. Tai Chi is a kind of psychophysiological intervention. It is an ancient Chinese martial art technique, and the exercises that has been practiced in it combines diaphragmatic breathing, relaxation with basic postures that slowly and smoothly move in gesture of circular movement. Means it is like obtaining one posture with slow movement, and it will increase the patient flexibility, promotes their balance, and increases the range of motion. And as it is very slow, it is a very slow technique, so people will be perceiving less pain. And it involves a gentle, continuous movement combining muscle strength, balance training. Tai Chi relieves the pain and increases the range of motion, flexibility, and promotes the balance in mental health and cardiovascular and respiratory functions. All these things will improve the pain and stiffness, and the famous posture for arthritis in Tai Chi is Sun style Tai Chi, which we saw in the previous picture. Can I have like previous slide? Before yes. The girl in the red obtaining the posture is a Sun style Tai Chi pose. This will improve the patient who are like suffering from knee arthritis. It will improve the stiffness, promotes balance and flexibility for the patient. And this Tai Chi is a slow movement, so it will also reduce the stress from the patient. Next, the next thing I'm going to explain is mirror therapy. Mirror therapy uses the optical illusion to ease the joint pain and stiffness in arthritis. To treat a person with arthritis, optical illusion occurs when the researchers show the movement and patient will try to mimic the movement. And the brain thinks that its own hand is moving and it helps to distract the patient from pain and reduce their stiffness. Next. The next treatment is virtual reality training. It is scientifically validated mind and body treatment. It is not only help to distract the mind from pain, also help to prevent the pain signals from reaching the brain. Virtual reality training induced exercises are more effective by improving the functional capacity, muscle strength, range of motion, and quality of life of arthritis patient. Next treatment is low-level laser therapy. It is a non-invasive light source treatment that generates a single wavelength of light, and it emits no heat, sound, or vibration. It is also called as biostimulator, and it is believed to function on the connective tissue cells and connective tissue repair. As we saw in osteoarthritis, there will be degeneration of cartilage and there will be formation of bone spurs. And this virtual reality training also act as this low-level laser therapy also act as anti-inflammatory agent wavelength. Commonly used is 660 to 905 and has a greater effect on tissue repair. The next treatment is extracorporeal shockwave therapy. It uses electrohydraulic electromagnetic piezoelectric source, and it also helping anti-inflammatory, angiogenic, and reduces the edema, and works on subchondral bone and cartilage because it will be more effective in case of osteoarthritis. Next slide. The next treatment is aquatic therapy. It's also called hydrotherapy. In this, it involves exercise inside the water, and the waves and buoyancy effect of water supports the weight of the body. This type of treatment is very beneficial for patients who are like very older and are overweight or obese. It also helps to relax the muscles and relieve the stress, reduce the muscle strain.
Please finish it as soon, Ma, because your time is up.
Okay.
Okay.
If you like move to conclusion. In this review of study, all the 7 articles are about the advanced technology of physiotherapy in treatment of arthritis, and all of them show the positive result for reducing weight, improve functionality, and areas in arthritis treatment. Further studies needed to see the long-term effects of this treatment in arthritis patients. And next slide.
Okay. Aragappan sir, you can ask your
Yes,
questions.
Ruksha, right?
Ruksar.
Ruksha.
Sorry. Ruksha, we have seen the post paper for the today with arthritis, and it's a combination of what you said is more of the combination of the applications along with exercise therapy. So a simple question, Rukshana. Here, we're targeting arthritis, right? So what's your opinion on giving recent applications and multiple protocols? Will RA improve with treatment, or RA always gets worse with the multiple applications?
Sir, as RA is a progressive disorder, we can maintain the movements in the joint. If we stop giving any treatment to the joint, we are not following any protocol to increase the increase the range of the joint, then it will always cause more problem to patient, and it will increase the stiffness in the joint more. So we have to keep on giving treatment for the RA people because it is progressive condition. and we can improve the range and improve the quality of life of patient if we are like working efficiently on it.
Okay, Ruksha. Ruksha, when it comes to OA, it is more localized in nature, so patients will always go for a immediate treatment. Comparatively to RA has very, very less awareness in public. I'm asking you a general question. Being the physiotherapy student, which year you are studying? Third or fourth?
Sir, I am fourth year.
Fourth year, okay. Being a physiotherapy student, you can share us what kind of ideas you have to promote RA patients to get involved in regular physiotherapy treatments. What are the ideas and plans you have?
So we can educate them about the condition they are having, and we can inform them that if we follow like regular physiotherapy, it will be beneficial for them, and it will improve their quality of life. Like that, we can counsel them, and we can help to help them as much as possible. And as I mentioned, in hydrotherapy, it will be more beneficial for the victims because in RA, the joints will be affected symmetrically. So for them, if they are like suffering from big joints like hip or knee, then it will be more beneficial if they are going through aquatic therapy. And
Okay, alright. When it comes to the presentation and the slides, it's very good, Ruksha. But the thing is still with the literature review, as we say earlier, it should be elaborated. But okay. Other than that, I'm okay with it. Okay. Aishwarya ma'am.
so, Ruksha, a good presentation only, ma. But again, as you said, the order is changing. Like again, you're explaining everything in the beginning, and at the last, you're adding the objective and other things. So always stick on to a particular order whenever you're doing any presentation. Okay. Regards to arthritis. My question is, did you come across any kind of an article which emphasizes like the specific kind of it can be a technology or exercise or whatever it can be. This is highly acceptable by this kind of population. Did you come across anything like that? You're talking about. Yes, ma'am. Now trending therapy in the field of physiotherapy for arthritis for the OA knee has become this Tai Chi approach, ma'am. In Tai Chi we are like having so many styles, so many postures to like improve their flexibility and strength of the muscle surrounding to the joint. So if they are having like tightness or a weak strength, then also it will unknowingly will cause this knee and other problems. And if they are having like overweight, then also it will cause. So being physically active and educating them about these conditions will also help in this. So I think Tai Chi will be now and we have so many researchers on Tai Chi, and I came across so many articles on this Tai Chi approach, especially its postures. Not only this style, there are other postures also which are helping moments with the patients who are suffering from arthritis of knee. Okay, so your topic is generally arthritis, right? Yes. Or did you work on any kind of specific topic? Your search was, your search criteria was generally arthritis only. Yes. Generally it was for arthritis. Arthritis, okay. So, you are mentioning about, with regards to rheumatoid arthritis, did you come across any kind of devices for improving the hand function? Ma'am, I came across this low-level laser therapy for this rheumatoid arthritis. No, that is a modality actually. I'm asking about devices like on innovation. Anything on innovation, recent innovation in management. Recent physiotherapy techniques only your research criteria was. So with regards to rheumatoid arthritis, did you come across anything like that? No, ma'am. Okay, then again, this blood flow restriction therapy. So, can you give this technique for everybody?
No, ma'am, we can't give this technique for everybody. Who are already hypertensive and who are having any other problems, we can't give this technique to them. And who are having like hemophilia, we can't give this technique for them because it can cause internal bleeding. Because
Okay, then again coming to this Tai Chi, did you get anything related to the stage of arthritis during which this technique can be given? This
yes,
treatment can be followed?
with the starting
What
stage. Yes.
Starting stage means like with regards to what your during the acute stage you mean?
Yes, ma'am. During the acute stage, it is helpful like that they have mentioned in article.
Okay, but you're a student, right? So can you think anything during the acute stage? Will the patient be able to tolerate this kind of a technique?
Ma'am, in first two stages, there will be minor cartilage of bone. So pain will be there obviously, but I think patient can tolerate this like posture and other things.
Because suppose if you are talking about a whole knee, so the same posture which you are trying to maintain means, so will they be able to tolerate few minutes of weight bearing on the pain side?
Yes, ma'am. This posture only will take place like the person has to be in this posture only for 30 seconds. So I think they can tolerate in first two stages.
Okay. So what I would suggest is, I mean, you're saying like you came across a lot of articles that are in favor of Tai Chi technique. So you can even do even more a particular search related to the stage of the disease. Okay. Or even if the person is obese, will they be able to tolerate this position? Obese people are obese with osteoarthritis. Again, so you can work on those concepts.
Yes.
You can do even more elaborate search on that. Okay. So apart from that, you try to work on in the order of the presentation. So next time when you're doing, so kindly stick on with the order, and need to add a lot of detailing related to the articles which you came across and what was the findings from each article that has to be explained in a detailed manner. Okay. Rest of the things are fine. Okay, Ruksha, thank you.
Thank you.
Thank you, Aishwarya ma'am, and thank you, Ruksha Khanum.
Thank you, ma'am.
And with this, we are completing the e-paper presentation. And now kindly share your feedback, judges. Aishwarya ma'am.
Yes, ma'am. Okay, so first of all, I would like to thank Harish sir for giving me this excellent opportunity. To deal with all these young minds for today, so the budding therapists, so the future of tomorrow. So I'm also a therapist, so you guys also in future you will become a therapist. So don't think we are just criticizing your work or finding fault in whatever you're doing. So we are just improvising you. We are molding you so that these inputs will fetch you a lot of benefits in the future. Okay, so take it in the positive sense. So again, so today's presentation, was excellent. Like being an academician and also a therapist, like I got a lot of inputs which was not known to me. So certain things were new. So I'll go and do some research on those concepts as well. So sir might know these concepts because he's into sports, so he might be knowing. So all did really well, and so kindly work on with the orders and what are inputs we gave. No, so you try to work on with that and do do a next, so going to the next level, you can show excellent results also. So whatever you came across when you're searching, I mean, when you're doing this presentation, no? So try to add these techniques in the future. So this might add benefits to the lot of patients which you're going to see in the future. Okay, so don't just stop for today. So research and learning is a never-ending process. So try to work on with the newest concept, and you can add a lot of evidence-based practice into your clinical practice as well. Okay, so thank you and all the best to all the participants. Thank you, sir, for the wonderful opportunity. Thank you so much.
Thank you for your words, ma'am. Next, Aragappan sir, kindly share your feedback for the paper, participant presentation.
Thank you. First of all, for the participants, as the ma'am said, like, I'm really happy and glad to be here today. And you guys are going to be the future physiotherapists, and you guys are, like, first of all, my artist congratulations, because out of like 30-40 papers, your paper got shortlisted, and we are really happy to judge you. One. The other thing is, don't think that we are criticizing or we are giving. Always we want to give you some valuable points. There is nothing like kind of criticizing here. We just need to give feedback and valuable points. So I wish you all the best, and you guys have to help patients in future. And we wish you to grow big and stay strong together with the commission. And I also like to congratulate Sai Foundation, Harish sir and his team. You guys are doing a wonderful job. I wish a lot of clinical people should come involved with academic. I'm a big fan for Harish with his entrepreneurship concepts, and he's the one who always want to bring matrix rhythm therapy concepts. I'm really happy and glad to be part of this wonderful occasion. So thanks a lot for the opportunity. Thank you.
Thank you for your words, sir. Now it's time for the vote of thanks. We have to come to the end of our session. It's my pleasure to extend my heartfelt gratitude and appreciation to all of you for gracing us with your presence at this e-paper presentation. I would like to express our heartfelt gratitude to our esteemed judges of this event, Dr. Aishwarya Vardhani ma'am and Dr. Aragappan sir, for your valuable insights and expertise knowledge sharing in this field. Next, I would also like to thank each and every participant who presented their papers today. Each presentation was unique and enlightening, showcasing the diversity and depth of the knowledge in our noble field of physiotherapy. Furthermore, I would like to express our sincere gratitude to our organizing committee headed by our respected MD, Dr. Harish Kumar, who worked tirelessly behind the scene of make this event possible. And I thank event coordinator Mrs. Preeti in her continuous work to make this event more successful. We would like to share this e-presentation in our YouTube channel named Dr. Harish Kumar. Winner will be announced by Monday to the registered email ID. Prize distribution will be taking place on the September 17th at Sa Healthcare Foundation Auditorium in Mylapore from 10:30 a.m. to 12 p.m. I welcome you all to the event. Thank you all. Thank you, Aishwarya Vardhani ma'am and Aragappan sir.
Thank you.
Thank you. Thank you.